Welcome to Explain, a series of health education programs published by the Patient Education Institute, the leading provider of interactive health education. This video includes general medical information and does not replace the medical advice of your doctor or healthcare provider. If you have questions pertaining to your medical condition, ask your doctor or healthcare provider.
De-quervains-tenosynovitis. Introduction. De-quervains-tenosynovitis is a common condition that causes pain and interferes with the use of the hand. Doctors may recommend surgery for people suffering from de-quervains-tenosynovitis. If your doctor recommends surgical treatment for your condition, the decision whether or not to have surgery is yours. This patient education module will help you understand the benefits and risks of this surgery. Anatomy of the hand. The hand consists of many bones. The bones are separated by special hinges called joints. Muscles make the bones move on their joints. You can grip objects with your hand because of the muscles located in the forearm. Each muscle is formed of two parts. The fleshy part of the muscle contracts and is the part that creates the movement of the bones. The tendon part of the muscle extends into the hand and attaches to the fingers. The muscles are attached to the bones of the forearms at the fleshy part. The muscles taper down and become tendons through the wrist and into the fingers where they attach to the bones of the fingers. When the fleshy part of the muscle contracts, the tendon is pulled toward the forearm like a cable and the fingers bend. Some of the tendons are covered by a special tube containing lubricating fluid. This allows smooth and painless movement. The tendons and their covering tubes are held in place by a specialized covering called a sheath. All the muscles and tendons of the palm are covered by a thick blanket of tissue called the palmar fascia. Symptoms and their causes. De-quervains-tenosynovitis occurs when the thumb's tendons and coverings become inflamed and swell so that they are unable to move easily in the sheath. This makes it difficult to move the thumb. The motion of the thumb is no longer smooth and becomes painful. De-quervains-tenosynovitis is usually the result of repetitive movements.
Sponsored by the Patient Education Institute. www.patient-education.com. Over 5,000 videos and interactive tutorials.
Alternative treatments. Avoiding repetitive motion may help with the symptoms. Another treatment includes resting the thumb.
Oral anti-inflammatory medications may be tried for reducing swelling.
Injections of steroids around the tendons to reduce swelling and promote healing are also a possibility. When all else fails, an operation may help. Surgical treatment. The operation is done through a skin incision. The surgical procedure aims at taking the pressure off the tendons by cutting the sheath. This liberates the tendons and frees their movements. The operation can be done under local, regional, or general anesthesia. This surgery is usually done as an outpatient operation, meaning the patient goes home the same day of the operation. Risks and complications. This operation is very safe with excellent results. There are, however, several possible risks and complications. These are unlikely but possible. You need to know about them just in case they happen. By being informed, you may be able to help your doctor detect complications early. The risks and complications include those related to anesthesia and those related to any type of surgery. Risks related to anesthesia will be discussed with you in greater detail by your anesthesiologist. Some of the risks are seen in any type of surgery. These include 1. Infection deep in the hand or at the skin level. 2. Bleeding. 3. A skin scar that may be painful or ugly. Other risks and complications are related specifically to this surgery. These are also very rare. However, it is important to know about them. Small nerves may be injured, resulting in weakness, paralysis, and loss of feeling in the hand. The tendon may be injured, resulting in weakness of the hand. There is also the possibility that the operation may not help the symptoms and may even make them worse. After a successful treatment, it is also possible for the symptoms to recur. After the surgery, your hand will be bandaged. Your doctor will ask you to keep your hand elevated above the heart level to reduce swelling. When you shower, you will need to cover the dressing with a plastic bag. Your doctor will tell you how long it will take before you can go back to work. This depends on your age, type of work, and your surgery, as well as other factors. Your doctor will arrange a follow-up visit to examine the incision and remove any sutures. Your doctor will indicate the hand rehabilitation program suitable for you.
If you like this video, please like and share. For similar videos, subscribe to our channel.
Summary. The muscles that produce the grip in the hand are located in the forearm. These muscles are attached to the fingers by tendons. When the muscles contract, the tendons pull on the fingers like cables. Hand surgery can help relieve your hand pain and immobility when other non-surgical treatments fail. This operation is very safe with excellent results. However, as you have learned, complications may happen. Knowing about them will help you detect them early if they happen.
Thank you for using Explain.